Dear students, in this module we will cover the Alma Ata Declaration made in 1978. This module helps us in understanding about the International Conference on Health and then the declaration made in the conference, and then we will also get understanding of health for all by 2000, the efforts made in this direction, and then the progress made so far through this module. Let us first of all talk about the International Conference on Health. The International Conference on Primary Health Care was held in September 1978 at Alma Ata, the then USSR. This was first of its kind, an international conference on primary health care happened for the first time, and this important conference expressed the need for urgent action by all the governments, all health and development workers and the world community at large towards protecting and promoting the health of all the people of the world. This is an important decision taken during the conference towards promoting health for all the citizens of the world, irrespective of their background. The conference declaration was path-breaking and it was very useful in the directions of policy making and program designing with reference to health care in general and primary health care in particular. Let us now have a look at the declarations of the conference. The declaration 1 says this: the conference strongly reaffirms that health, which is a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity, is a fundamental human right, and that the attainment of the highest possible level of health is a most important worldwide social goal, the realization of which requires the action of many other social and economic sectors in addition to the health sector. This is the declaration on the basis of the definition of health given by the WHO. The WHO defined health as not just mere absence of disease or infirmity, but it is well-being in terms of physical, mental and social aspects. The totality of well-being or the complete well-being of an individual encompassing physical, mental and social dimensions. In line with this definition, the first declaration of the conference gives emphasis to ensure health for all the citizens, and it also talks about the combined efforts that are required from the people from various sectors including social, economic, besides the health sector. Let us now move to the declaration 2. The existing gross inequality in the health status of the people, particularly between developed and developing countries as well as within countries, is politically, socially and economically unacceptable and is therefore of common concern to all the countries. This declaration holds good even in the current days, with the kind of inequalities we find between the countries, between the continents, between the regions, and even within the countries. For instance, in a country like India, the kind of inequalities we normally observe between different states in terms of health status of the people living in the state supports this declaration, and the kind of situation we find now reiterates the need for this declaration even after several decades. Let us now turn to the declaration 3. Economic and social development based on a new international economic order is of basic importance to the fullest attainment of health for all and to the reduction of the gap between the health status of the developing and developed countries. The promotion and protection of the health of the people is essential to sustained economic and social development and contributes to a better quality of life and to world peace. This declaration also talks about the importance assigned to achieving health for all, and also highlights the importance of reducing the gap in terms of health status of the developing and developed countries. It also talks about promotion and protection of the health of the people, so that it can lead to economic and social development. Finally, the world peace is linked to this. This is beauty of this declaration. It also talks about the peace across the world and the role of health status in ensuring peace across the world is the message from this declaration. Let us now move to the declaration number 4. The people have the right and duty to participate individually and collectively in the planning and implementation of their health care. This declaration recognizes the voice of people and power of people and power of people's voice. Any policy or program initiative can succeed only when the society at large, the community at large accepts it, owns it and participates in it. This declaration is in line with that observation. Let us now look at the declaration 5. The governments have a responsibility for the health of their people, which can be fulfilled only by the provision of adequate health and social measures. A main social target of the governments, international organizations and the whole world community in the coming decade should be the attainment by all people of the world by the year 2000 of a level of health that will permit them to lead a socially and economically productive life. Whatever has been referred in this declaration 5 is true even in the current days. It talks about the responsibility of the government in ensuring health status of the people. It also talks about the involvement of international organizations and world community, so that all citizens can lead socially and economically productive life. The declaration 5 also talks about primary health care and its role in attaining the target as part of the development in the spirit of social justice. Moving to the declaration number 6. Primary health care is essential health care based on practical, scientifically sound and socially acceptable methods, and technology made universally accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-determination. This declaration talks about the cost of health care and affordability of the same for the citizens. It also talks about accessibility of the health services and the technology that is accessed by the community. Let us continue about the declaration number 6. It forms an integral part both of the country's health system, of which it is the central function and main focus, and of the overall social and economic development of the community. It is the first level of contact of individuals, the family and the community with the national health system, bringing health care as close as possible to where people live and work, and constitutes the first element of a continuing health care process. Here the emphasis is given to making the services available at the doorstep of the community, so that they get benefit of the services that are available. We all know in any sector, particularly the health sector, 4 A's play an important role: awareness, availability, accessibility and affordability. So, this declaration is in line with the 4A concept, so that utilization of the health services is ensured. Through that, we can also have better health status for all the citizens of the countries. Let us now understand the declaration number 7. Here the concept of primary health care needs to be understood. The primary health care reflects and evolves from the economic conditions and socio-cultural and political characteristics of the country and its communities, and is based on the application of the relevant results of social, biomedical and health services, research and public health experience. The second component of this declaration talks like this: addresses the main health problems in the community, providing promotive, preventive, curative and rehabilitative services accordingly. Here the words are to be underlined. It talks about promotive services, preventive services, curative services and rehabilitative services in accordance with the needs of the people, in accordance with the kind of health problems the community is having. Let us continue with the declaration 7. Includes at least education concerning prevailing health problems and the methods of preventing and controlling them, promotion of food supply and proper nutrition, an adequate supply of safe water and basic sanitation, maternal and child health care, including family planning, immunization against the major infectious diseases, prevention and control of locally endemic diseases, appropriate treatment of common diseases and injuries, and finally provision of essential drugs. Here we are talking about the prevention of diseases, the local diseases and appropriate treatment for the diseases and injuries, and also from the supply side, provision of essential drugs. Then the fourth component of this declaration number 7 involves, in addition to the health sector, all related sectors and aspects of national and community development, in particular agriculture, animal husbandry, food, industry, education, housing, public works, communication and other sectors, and demands the coordinated efforts of all these sectors. Here the emphasis is given to multi-sectoral approach with involvement of all the sectors that are involved in development field. The fifth component of Declaration 8 requires and promotes maximum community and individual self-reliance and participation in the planning, organization, operation and control of primary health care, making fullest use of local, national and other available resources, and to this end develops through appropriate education the ability of communities to participate. This component of Declaration 8 talks about the planning, organization and implementation of the mechanism, and also talks about utilization of the resources that are available at various levels, so that the community gets the benefit. It also talks about education of the community, so that their participation is ensured. The next component should be sustained by integrated, functional and mutually supportive referral systems, leading to the progressive improvement of comprehensive health care for all and giving priority to those most in need. The emphasis here is towards having effective and supportive referral systems, and it also talks about priority to be given to the people who are the most needy, who are more vulnerable. These are very fundamental concepts when we are talking about health care and health status of the people. The seventh component says like this: relies at local and referral levels on health workers, including physicians, nurses, midwives, auxiliaries and community workers as applicable, as well as traditional practitioners as needed, suitably trained socially and technically to work as health team and to respond to the expressed health needs of the community. In accordance with the health needs of the community, the mechanism should be in place by involving all types of health workers, health service providers, including the traditional practitioners. In many cases, the traditional practitioners are more accepted by the community. They are the first contact point for the community in case of any health need. In view of that, this declaration talks about involving the traditional practitioners as well. Of course, these traditional practitioners need to be trained adequately. Now, let us move to Declaration number 8. All governments should formulate national policies, strategies and plans of action to launch and sustain primary health care as part of a comprehensive national health system and in coordination with other sectors. To this end, it will be necessary to exercise political will to mobilize the country's resources and to use available external resources rationally. Here, the points to be noted include the need for formulating policies, strategies and plans of action at national level, and implementing the same and sustaining the same, so that the needs of the people are addressed. And the political will forms an important component in the whole scheme of things. Besides the ability of the governments to mobilize the resources so that the external as well as internal resources are made use of in a rational way. Let us now move to declaration number 9. All countries should cooperate in a spirit of partnership and service to ensure primary health care for all the people, since the attainment of health by people in any one country directly concerns and benefits every other country. In this context, the joint WHO UNICEF report on primary health care constitutes a solid basis for the further development and operation of primary health care throughout the world. Here, the points to be noted include the collaborative work, the joint ventures in the field of primary health care, namely to mention WHO and UNICEF's report is mentioned here, and it also talks about the spirit of cooperation and spirit of partnership to ensure primary health care for all the people. In declaration number 10, an acceptable level of health for all the people of the world by the year 2000 can be attained through a fuller and better use of the world's resources, a considerable part of which is now spent on armaments and military conflicts. This is a valid point. The validity of this holds good even today. Some of the governments spend more and more money on military conflicts and armaments. The declaration suggests and recommends that the resources should be used to promote the health status, to improve the health status of the people, and then the target was to be achieved by 2000, but even in this year, even at this point of time, we are not able to achieve this target in many of the countries. This is a concern from the health point of view. And then a genuine policy of independence, peace and disarmament could and should release additional resources that could be devoted to peaceful aims and particularly to the acceleration of social and economic development, of which primary health care as an essential part should be allotted its proper share. Now, having gone through the various declarations, various aspects covered by the Alma Ata Declaration of 1978 International Conference on Primary Health Care, let us understand the importance of the Alma Ata Declaration. The Alma Ata Declaration of 1978 has been instrumental in primary care development worldwide. The principles defined in the declaration were primary care to address health problems in the community, providing preventive, promotive, curative and rehabilitative services, reflecting the economic situation and the social values of the country and its communities. These are very relevant. The health service provision should aim at preventive, promotive, curative and rehabilitative components. The services should be towards promoting all these aspects related to health care. Let us continue the discussion about importance of the declaration. Primary health care was considered to be especially important for the low income countries. The essential elements of the primary health care were promotion of proper nutrition and adequate supply of safe water, basic sanitation, maternal and child care, including services of family planning, besides immunization, control of endemic diseases, health education and appropriate treatment for common diseases and injuries. All these aspects need attention when we are talking about primary health care. And then they also emphasize the need for multi-sectoral approach, convergence of services towards better primary health care for the citizens. Due to various administrative reasons, perhaps mental health was not mentioned in a big way in the Alma Ata Declaration. This is one of the concerns. Now, let us understand about the declaration per se. The declaration, however, did not include mental health. In the official report of the conference, talked about promotion of mental health as one of the essential elements of the primary health care. Perhaps this accounts for slow pace of the integration of mental health elements and concepts into primary health care in the world. This is a question to be answered. Let us talk about the primary health care. Primary health care per se is not only the first level of contact with individuals, but also the first level of contact for the family and the community as a whole. The individual, the family as well as the community contact the primary health care provider at the first instance, depending on the necessity, depending on the referral services and referral network that is available. They may seek the services at higher level of health facilities, depending on the necessity, of course. So, bringing health care as close as possible to where people live and work, this is the objective behind the primary health care concept. The health services should be available at the doorstep of the people, wherever they are living or wherever they are working, the place of residence or the place of work. They should be able to access the health services from the place of residence or place of work. The Alma Ata Declaration pointed out that primary health care, among others, should be sustained by integrated, functional and mutually supportive systems. Of course, the evidence that is available indicates that this integration has not been achieved so far in many of the communities, societies and countries. There could be some exceptions. In some countries, some societies, it might have been achieved, because the complexity and fragmentation, they determine the current healthcare systems across the world, and one can see this more in the countries where primary health care is less developed. We just discussed about not much of mention about mental health in the declaration of the International Conference on Primary Health Care few minutes back. Let us spend some time to understand this further. Evidence that is available so far also suggests that current primary healthcare delivery system is not focusing on the aspects relating to mental health. To cite a research study from UK, the study expressed concern about the fat relating to the general practitioners and primary care physicians, making a diagnosis and arriving at a decision about treatment, and this was mainly influenced by the severity of the symptoms and influenced to a less extent by the recognition of social and environmental stress factors. Now, having discussed about the mental health related concerns, of course not in an elaborate way, very briefly, let us now talk about the health for all. The Alma Ata Declaration asked for health for all. In other words, as a minimum, all people in all countries should have at least such a level of health that they are capable of working productively and of participating actively in the social life of the community in which they live. The evaluation of the progress in the implementation of global strategy for health for all by 2000, it was carried out in 1997. It indicated that significant improvement has been there worldwide, both in terms of health status and access to health care, and increasing number of member states reported to be carrying out monitoring and evaluation of their health for all strategies at specific intervals. And in 1985, 147 out of 166 member states reported at least with respect to the global indicators. In 1997, 158 member states reported about covering the indicators. 90% of the countries reported in terms of immunization, but only 30% reported on access to local health services. As regards the commitment for health for all, overall there has been a strong political commitment to achieve the health for all goals, and most countries have endorsed at highest level with policy and strategy inputs. But the existing health services are also reoriented. The existing health services are reoriented to a health system based approach on primary health care by taking into account the role of individual, family, community and local NGOs as well as the health personnel. So, several efforts are being made, substantial attention has been given to health of women and their role in development. Across the globe, there have been significant increases in case of primary health care since 1985. Child immunization levels have improved and trained attendants at childbirth, local health services and water supply were also improved. And of course, when we talk about the progress, gaps between developed and developing countries have been significantly reduced, though the improvements in least developed countries have been less satisfactory. Coverage levels for various elements of primary health care have also improved in developing countries. And then we also have seen considerable improvement in child immunization coverage, and it is estimated that by 1997, 106 countries representing 64% of the global population had an average life expectancy at birth of above 60 years. Similar kinds of improvements were noticed in case of immunization as well. There also have been some concerns, and countries use various methods to finance their health systems, but very few countries are satisfied with the distribution of financial resources between promotive and curative services. There are also problems associated with provision of human resources for health problems, and the health systems are becoming more complex and costly, and application of new and existing technologies is becoming more refined. So, making right decisions about allocation of the scarce resources is becoming very difficult. There are also some concerns about the quality of care. WHO recommends and gives emphasis to provision of and improvement of quality of care while providing health care services. To summarize, in this module we looked at the background for the Alma Ata Declaration in 1978 and the kind of importance the declaration gives to primary health care. We also looked at the status in terms of achievement of health for all by 2000, though many countries are behind the schedule to achieve this target. And we also looked at the evidence that indicates need to strengthen the primary health care services with focus on women, children and other vulnerable sections of the society. Thank you so much.